You've called for changing the name of the virus, saying that monkeypox is, quote, potentially stigmatizing. Why is changing the name of monkeypox a priority in the midst of this outbreak?
Well, we can walk and chew gum at the same time. So, I wrote a letter to the WHO. Doesn't take that long to write a letter. And so, as we're doing our operational work, as we're doing our rollout of the vaccine, we raised up this issue because language matters, choice of language matters. We know that this is not just an issue of politics and jargon. This is an issue of public health because we know that stigmatizing language, racist language, demonizing language can push people further into the shadows, cause them to delay seeking care, and ultimately worsen health outcomes. We can look back at the HIV epidemic, which wasn't called HIV in its early days. It was called gay related immune deficiency, causing a great deal of stigma to the gay community. We can look at COVID-19, which was pejoratively referred to as the Asian flu or Kung flu, and the impact that had on Asian American communities and rise in Asian American hate in this country. And so, why, when we have a name that has really no accuracy, it has no descriptive impact or no descriptive benefit, doesn't accurately describe anything about the virus or the symptoms itself, why not try to choose a name that's more neutral, that can be widely understood, and that doesn't call out or affiliate any sort of either racist or stigmatizing language with a particular community group?
Just a quick follow up. Your health department, your Twitter feed, I think you've said the term monkeypox several times during this interview. If it's potentially stigmatizing, why keep using the term?
Well, internally here at the health department, we are using MPV as much as possible. We're also mindful of not trying to course correct multiple times. It's why I wrote the letter to the WHO. Ultimately, the WHO can change the nomenclature for the globe. They created the nomenclature COVID-19, which was adopted widely around the globe. And so we're hopeful they'll decide on something soon that we can all adopt. Meanwhile, we're using the things that will cause the least amount of confusion, and hopeful that a change will be made that can reduce stigma.